Hello, everyone. It's January the 4th. I hope everybody has started off the new year with a happy new year. And regretfully, since we've been with you, we've got 26 additional deaths. You can tell by my voice, I'm a little hoarse and everything. Been tested a whole bunch of times in the last few days. You know, this thing, there's no question whatsoever. I want you to really pay close attention to Dr. Marsh, but this thing is extremely contagious and it moves very, very quickly, these new variants. But, you know, I can tell you that my daughter, a couple of our grandbabies, a little girl, a little boy, you know, that our grandbabies got feeling not so hot and everything. First started with a lady that just had been around them a little bit. She tested positive. Then all of a sudden our grandson and granddaughter tested positive. Then Jill now has tested positive. This thing moves and moves very quickly. So Kathy and I have been tested a bunch. I've probably been out in the weather and everything and gotten a little cold, but I'm feeling lots better, and Kathy's doing the same. But boy, I'll tell you, you know, this thing moves, and it moves very quickly, and it can have devastating results. Like I said, we've lost 26 additional West Virginians, and I want you to honor them with all your respect right now, please. But the 2,662nd death is a 68-year-old male from Kanawha County. I'm sorry, let me start all over. The 7,662nd death is a 68-year-old male from Kanawha County. The 7,663rd death is a 62-year-old female from Lincoln County. The 7,664th death is an 88-year-old female from Wood County. The 7,665th death is a 71-year-old female from Cabell County. The 7,666th death is a 59-year-old female from Brooke County. The 7,667th death is a 72-year-old male from Mercer County. The 7,668th death is an 85-year-old female from Jackson County. The 7,669th death is a 71-year-old male from Berkeley County. The 7,670th death is a 64-year-old male from Marion County. The 7,671st death is a 75-year-old male from Kanawha County. The 7,672nd death is a 99-year-old female from Putnam County. Bless her. Bless all these folks. The 7,673rd death is an 89-year-old female from Cabell County. The 7,674th death is a 63-year-old male from Putnam County. The 7,675th death is an 88-year-old female from Raleigh County. The 7,676th death is a 65-year-old female from Cabell County. The 7,677th death is a 90-year-old female from Harrison County. The 7,678th death is a 79-year-old male from Greenbrier County. The 7,679th death is an 80-year-old male from Fayette County. The 7,680th death is a 75-year-old female from Taylor County. The 7,681st death is a 70-year-old male from Greenbrier County. The 7,682nd death is a 56-year-old male from Berkeley County. The 7,683rd death, an 81-year-old female from Cabell County. The 7,684th death is an 82-year-old male from Mineral County. The 7,685th death is a 92-year-old female from Raleigh County. The 7,686th death is a 95-year-old female from Upshur County. And the 7,687th death is a 43-year-old male from Harrison County. 7,687 people now have lost their lives in West Virginia with this stuff. I remind you over and over and over, Kathy and I have all of our booster shots. We're fully boosted and everything. You know, we're surely around folks that have this. It's very contagious. without any question, it's not over, but we can live with it. And we can exist, and we can go on about our lives, and we don't have to wear this crazy mask and shut down businesses and everything under the sun, close our schools. Look how behind our kids have gotten with what we had to do, and literally at the end of the day, we can live with this, but I really urge you to get vaccinated and get your booster shots. The active numbers are 1,439, 551 new positive cases, daily positivity rate 11.29, cumulative rate at 8.58, recovered cases 617,548. We now have 360 people hospitalized in West Virginia. This thing really peaked up, and then it really dropped way off. And now here we go again, boom. Remember, the number at 500 really puts a strain on our hospitals in West Virginia. This is a big number jump, big number jump. 56 in the ICU units and 17 on ventilators. 25 of our counties, half of our counties are yellow almost, or a little more than half, and half of our counties are green. Like I said, as far as getting your booster shots, come on, absolutely. If you don't want to end up in the hospital or end up with something really bad, get those booster shots. You got to do that. I also remind you about the flu shot. This RSV, flu, COVID is still circulating around everywhere, and it's not gotten bad yet. We had a very small blip on the screen of really cold temperatures, but overall, it's not gotten really bad. It will before this winter's over. The numbers continue to slowly move forward. As far as the vaccine calculator, it's up there. If you go on our website, get registered and everything, we'll be able to remind you as to when you're supposed to get your booster shots. All the other COVID information is up there on our website. There's 63 outbreaks in West Virginia right now in our long-term care facilities, none in our church communities. There's 58 inmate cases and 15 staff cases. I urge you all the time about giving blood. The Red Cross really needs you. All of us really need you. Check with your physician. If you get to go ahead, please consider. Today, through Dr. Coben and everything, we are announcing a new appointment to DHHR as our new state health officer, and commissioner of DHHR's Bureau for Public Health, and that is Dr. Matt Christensen. This appointment is effective immediately. Dr. Christensen currently serves as our director of DHHR's Office of Drug Control Policy. We're very confident. I appointed him to this position in October of 2020, and he's done a fantastic job. He also serves as the associate professor in the Marshall University Jones C. Edwards School of Medicine, where he practices primary care and addiction medicine. I really wanted to especially thank Dr. Amjad. She's still not going anywhere. She still agreed to stay around and everything. She wants to be with her practice, and that's good stuff. But she's still there to be able to assist and help us, and will do so all the time. But I do congratulate Dr. Christensen and Dr. Coben's recommendation, and so I'm sure Matt will do a wonderful job. Thank you, Matt, for stepping up all the time. There has been some minor flooding in West Virginia and the northern panhandle. A couple of inches of rain fell in Marshall County, and the Ohio River has heavy rain moved the Ohio River most of the day, of yesterday, which led to some substantial streams and creeks being overfilled. It's not really all that bad. It's primarily in the town of Cameron, and but we want to watch, and we'll respond, and we are responding. In Beckley, West Virginia, we've had a water crisis. I congratulate John Valinsky. John has done an amazing job. We've been in touch with John, and we've been on top of it. And as of now, we're down to really just a few dozen folks that are residing in higher elevations or more distant portions to the Beckley water system, but crews have worked around the clock to get this, this problem back up and going and everything. And we thank all those that have worked very, very, very diligently to do this amazing job. It's tough stuff and everything, but they've done a good job. We had a school bus crash this morning or in Ohio County. I can report to you that all the students are okay, the driver's okay. The crash happened early this morning on Dixon's Run Road, and the bus went over a hill, and there's a good chance that bus got ran off the road, and the Ohio County Sheriff's Department is into this and checking it all out and everything, but we're super thankful. 15 of our kids went to the Wheeling Hospital as a precautionary measure, but nobody with any serious injuries, all minor stuff, but that's really good, really, really good. Hope Gas, we're getting to be, so proud of them and everything, and Hope Gas just recently moved their new corporate headquarters to Morgantown, but Hope Gas announced yesterday that they're going to purchase People's Gas, which services 15 of the West Virginia counties. This is one of the largest local natural gas companies in West Virginia that's employing hundreds of West Virginians. We're really, 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 grateful to Hope and all that they're doing, and so we congratulate them and thank them so much. I'll be having my State of the State address on January the 11th at 7 p.m. I want everybody to stay really close to in tune to what we say that night. Hopefully I'll be able to talk a little bit better, and but we'll be outlining a state that is really, really going in the right direction. We'll have several announcements of companies that, are coming to our state or companies that are already here. Absolutely, we'll be announcing the biggest tax cuts in the history of this state, hands down, and so it'll be a great, great year to celebrate our hardworking West Virginians, and hopefully, things will move right through the legislature, and we'll be able to pass on those tax breaks and tax cuts to people to celebrate all the goodness that's been happening in West Virginia as everyone, and I underline everyone, of the hardworking West Virginians has pulled the rope for decades, and we need to reward them right now. And so hopefully we'll be doing that, and we'll surely be announcing all the stuff about my tax plans and program on Wednesday, January the 11th at 7 p.m. So tune in. Please be sure to do that. Last thing I have is, we've been almost 3 years now at the COVID briefing. I'll never forget this. At my first briefing, my very, very first briefing, I was outlining everything, and one of the reporters said, will you be here? Will you be here for the next briefing? Will you be here for the next few briefings? Well, I haven't missed a one. And through all that, I'll promise you there's no way that there's any other governor that can say that they've been in front of the people as often as I've been in front of the people, because I felt like you needed to know. Now, with all that and everything, you've honored me beyond belief because you trusted me. And we pulled the rope together in some way, somehow. This state, the third oldest, or maybe the second oldest in the nation, with a state that just had the first, number one, in all chronic illnesses all across our state, or in the chronic illnesses across the state. Through all that, we've had to make lots and lots of tough decisions, and I hope you think that we made the right ones. We didn't have a playbook. We absolutely tried to do it with good sense, with the greatest experts that I could have ever put together. I can never, ever thank them enough. Dr. Amjad, our coronavirus czar, Clay Marsh, General Hoyer, Secretary Crouch, all the different people through all the health agencies all across this state. boy, what a job we did pulling the rope together. And I can never thank them enough in every way. But we're going to change things up. We're not going to just cut the briefings off and everything. You know, we've never shied through all these briefings. We've taken every question that came from the media on anything. And we've never shied away from the tough questions. I hope you're really pleased that I've answered the tough questions. I've not dodged the tough questions and said, we'll get back to you tomorrow or whatever it may be. Now, if we didn't know, you know, we had to tell you that. But that happened very, 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 very few. You know, but I want to announce that what we're going to do with the new year, we're going to move forward. And so since we ended our state of emergency and everything, it's time to refocus our briefings in a little bit different way. You know, so I want to read this to you. Going forward, my briefings will be rebranded and called the Justice Administration Update Briefings. I will take time, as I always think we should, to honor those we've lost with COVID, because it's something that, like it or not like it, we should do. We should honor those and we should respect those. We will still provide updates on COVID as necessary, and we will take questions from the media as we have in the past, but I will also begin incorporating other elements into the briefings. You will hear from our cabinet secretaries from time to time, you know, on the things that are going on all around the state, and hopefully good things that are going on around the state. So it'll be a little bit different. It'll still have, you know, all the COVID updates, and if by chance this thing turns tough again and it really, really, really gets going, then we'll go back to a purely COVID briefing. But this way, I think it gives us the opportunity to reflect on all the things that are happening all across our state, and gives you a great deal of information that you may like to have and everything. So we're going to try it that way, and like I said, you can ask me, the media can ask me any question anytime. I'll do the best I possibly can to answer it, and answer it honestly. You see, the one thing I've challenged you over and over, whether it be the media or anyone, I've said over and over just this. You find something that I knowingly have not told you the truth about. Absolutely, you can't do that, because I'm not going to do that. I'm going to tell you the truth all the time. And like it or not like it, but that's just the way it is. I'm not a politician. I don't want to be a politician. I absolutely want to be your governor and do it the way that our forefathers really thought that things should be done. And that is serve and tell you the truth. And literally, you have been so good. It's been tough at times to tell you really the truth. But you've responded, West Virginia. You're the best, and I love you with all my soul. That's all I got right now.
All right, thank you, Governor. Let's now go first today to Dr. Jeff Coben, the Interim Secretary of the Department of Health and Human Resources.
Well, thank you, and good afternoon. I just want to reiterate my thanks and appreciation both to Dr. Amjad for her great service over the last several years for the Bureau for Public Health, and also want to thank Dr. Christensen for his assuming the responsibilities and his new position as the State Health Officer and Commissioner of the Bureau for Public Health. In addition to all of what Governor Justice already mentioned, Dr. Christensen, as part of his training at Marshall University, also trained specifically in public health, and I think that is a great asset to bring a primary care physician who is a West Virginian and is trained in public health to help with the leadership of that bureau. So we're very excited about that, and excited about Matt, and appreciative of both him and Dr. Amjad. As the governor mentioned, Matt will be stepping down from his current position in the Office of Drug Control Policy. The Assistant Director, Rachel Thaxton, will continue to lead that organization while we conduct a search for Matt's replacement as the director for ODCP. So with that, I would also just want to mention that over the course of the New Year's weekend, the DHHR has implemented a new information system for all of our social services and child welfare functions. This is a very large transition that we've made from an outdated information system on eligibility and services for our most vulnerable populations to a new updated information system. And that has gone quite well with a lot of people working really hard throughout the New Year holiday to implement that program. So we're going live with that, and we believe that will really help with our efficiency as well as the ability to get information out on all aspects of what's going on in social services and child welfare across the state. So I think I'll turn it back over, and happy to answer any questions that might be relevant to DHHR.
All right, thank you, Dr. Coben. Next, we'll go to Dr. Clay Marsh.
Well, good morning. And following what the governor said and what Dr. Coben said, we are very grateful to the service of Dr. Amjad. Look forward to Dr. Christensen playing a key role for us in our state moving forward. I do want to touch on a couple of new findings in the COVID-19 current issues. So the virus continues to mutate, and we now have a mutation that appears to have originated in the United States. And this new mutation, which all these mutations now are becoming, I don't even know how the names come about, but this new mutation is named XBB 1.5. And XBB 1.5 is a derivative of the BA2, the Omicron BA2 virus, but it's picked up a critical mutation in the spike protein. Remember, the spike protein is the part of the virus that binds to a key receptor on our cells and allows the virus to get into our cells to infect us. And this XBB 1.5 virus is very evasive to our immunity and now basically is not inhibited by any of the commercial monoclonal antibodies. So the monoclonal antibodies from a treatment perspective are no longer really relevant related to this variant. But it also, because of this new mutation in the spike protein, can bind to the human receptor better. And so it's really gained a pretty substantial impact on its ability to infect and to cause more cases. And to that level, this variant over the last 3 weeks has now become the most common variant in our country. And in the Northeast is responsible for about 75% of the new cases across the country, about 41% of the new cases. And we saw a doubling of the impact of this XBB 1.5 variant in the last week. So we know that older people are most selectively targeted now, and the governor read 20 plus names at the beginning of the press briefing. And we know that West Virginia is a state with many older citizens who have many chronic illnesses or at high risk and susceptible to the impact of COVID-19, but particularly this variant. In the northeastern part of the country where this has started, we see a substantial increase in hospitalizations. And today, as the governor mentioned, we have 360 West Virginians in hospital beds with COVID-19. And remember, right before Thanksgiving, we were about 114 people. So this new variant, which is probably not even shown its full force in West Virginia, will most likely cause those numbers to go up. We know that only about 37.5% of all Americans over 65 have gotten the new Omicron booster shot. And new data shows that people over 65 that have gotten the Omicron booster shot do have about an 80 to 90% reduction in hospitalization and about a 2.5 times reduced risk of death versus people that haven't got the Omicron booster shot. This is for over 65-year-old people. And so we know that the Omicron booster shot does have benefit against this particular variant, as well as other variants that are circulating. So it is really important, particularly during this winter season as the weather gets colder, for people in high susceptibility categories, the over 65-year-old categories, and over 50-year-old categories to really pay attention and please get updated on your booster shot. Of our hospitalizations in yesterday's admissions, almost all were over 50 years old, and the number really ramped up over 70 and over 80. So we know our older population now is going to be the one most vulnerable to this. And importantly, in the United States, we just passed 100 million cases of COVID-19. And we know that this is by far the most infectious variant to date. And the virus continues to gain power. And so we need to also gain power to offset it. So with that, thank you very much and turn it back to the governor.
Thank you, Dr. Marsh. Retired Major General Jim Hoyer is also joining us today and is available for questions. We'll now go to questions from members of the media. The first today from Charles Young with WV News.
Hi, this is Charles Young with WV News. I was hoping to get a little bit of perspective on our hospital numbers. You know, as Dr. Marsh and the governor mentioned, we're at 360 as of today, which means our hospitalizations haven't been this high since mid-August. But, you know, in August, we were only dealing with COVID. Now we have these other elements of the tridemic. Could you give us some perspective on how those other elements, in addition to COVID, are affecting our hospital staffs? Thank you.
Dr. Marsh, please.
Well, thank you, Charles, and thank you, Governor. We do know, Charles, and are in very close contact with the Hospital Association and our hospital leadership. We know that we still certainly have the capacity to be able to take care of all of West Virginia. So that does not appear to be an issue that we have to address immediately. But we also are cognizant, as you suggest, that we are also seeing an uptick in influenza and the flu, and RSV, which has plateaued a little bit, had been a really significant cause and driver of hospitalizations in children particularly. So we do know that during this winter season, because COVID did give us a break in that face-to-face infection over the last couple of years, that our immune systems are not as primed to these different viral infections as they were before. And we have seen a reduction in the uptake of not only the Omicron booster shot, but also of other vaccines like the flu vaccine that are really important protections for us all during this holiday or during this now winter season. The holidays just passed. So it is important if people haven't gotten their flu vaccine to get it, if you haven't gotten your updated Omicron booster shot to get it, because we know that these are really important protections, not only for the hospital numbers that we talked about, but for individuals and our medical staff that work in hospitals, because staffing is still an issue for us in all of our healthcare facilities. Thank you.
All right, thank you, Charles. Next, we'll go to Kenny Bass with WCHS and Fox 11.
Thank you, Jordan. Welcome back, Governor. Sorry you're not feeling well. Hope you get better soon. But I wanted to ask you about the competing tax plans that we're expected to see in the legislative session. It's very famously you and Senate President Blair have some obvious differences on how we should move forward. Do you see a road for compromise? Have you guys talked at all? Do you plan on talking with them? What would be the best way forward to try to get something substantively finished during the session that you could agree with and the Senate could also agree with? Thank you.
Well, Kenny, I appreciate the question, and let me just tell you this: that I stand ready to talk, to compromise, to do the work of the people of the state of West Virginia. The people of the state of West Virginia spoke really clearly, did they not, in the last election? They basically said, we the people, we want to control, our stuff on a local level, and we the people absolutely are not crazy about big corporations getting big tax breaks and everything. We want some money. We're fighting inflation every day, and it's tough. It's really tough. We brung you to the dance. That's what the people of West Virginia are saying to us. So I think when you see my tax plan and everything, and it'll be coming out really, really soon, it will be different, and but it will be, it will be a plan that I hope that we can embrace. I've had extensive conversations with the House. I think the House and myself are on the same page together. We both believe that we can really get on a pathway of absolutely someday being able to eliminate our state income tax. Wouldn't that be something? I mean, really and truly, there's so many opportunities right now, it's off the chart. We just announced yesterday, December came in, I think at 146 or 145 million over budget. These surpluses are enabling us to go out and compete in the world and bring businesses in, and they're coming. They're coming. I mean, for crying out loud, you can say anything you want to say, but absolutely, it's tough to not say, if it ain't broke, don't fix it. And right now, we're anything but broke. Literally, we're moving in West Virginia, and we're moving in a way that is really good. Now, and so absolutely, Kenny, to answer your question, our people in contact, I stand ready to meet and work with the Senate, to work with the House. Absolutely, we can compromise, and at the end of the day, nobody's got the perfect answer. Only God above has got that perfect answer. But I think if we're adults, absolute adults, and at times people have a struggle and a hard time with being an adult and not being a child that's absolutely just trying to hit out, because you lost something or whatever it may be. If we can be real adults and we can absolutely have conversations that were meaningful, and we don't get bogged down with just needless stuff, childish stuff. The momentum is unbelievable right now. We want to keep it going. We absolutely don't want to back up. I've said it a million times. All the building blocks are in place right now, and we're really cooking. The only way in the world we'll screw this up is blow our own legs off. That's not what the people elected us to do. So I'm very hopeful that we can, come out of this with a great, great, great tax plan that gives our people an incredible tax break.
All right, thank you, Kenny. Let's go next to Mark Curtis with WOWK.
Good morning, Governor and cabinet members and fellow reporters. And Governor, as you suggested about your briefings, I'm going to deviate to another area beyond COVID. But as I'm sure you saw, the Senate President and Majority Leader Takubo and other Senate leaders wrote a very lengthy, detailed letter to Interim Secretary Coben regarding DHHR reforms and what needs to be done. And then outgoing Minority Leader Baldwin also weighed in on changes at DHHR. I'm wondering if, and if Dr. Coben wants to weigh in, please do, but if each of you has initial reaction to that letter from the Senate, and with the legislature coming into session next Wednesday, do you have some ideas where maybe you have common ground with the House and the Senate that you can get done in terms of DHHR reforms, and what are the priorities?
Mark, there's got to be common ground. I mean, for crying out loud, but I don't know. I don't know how in the world you dispute the very, very best winning experts that you could possibly have. You know, just think about it. You know, we're moving, and we're moving on a report that was done by a top-notch agency, the McChrystal report. We're absolutely moving with Dr. Marsh, General Hoyer, Dr. Coben. I mean, there is absolutely superstars working on this right now. Now, again, if the goal is to be able to jump up on a soapbox and beat your chest and everything, that's not my goal. My goal is get stuff done. And I've done that, have I not? Absolutely. My goal is to do goodness for our people. My goal is not to make a scene, you know, and at the end of the day, we'll look at everything the Senate offers and offers up and everything. We'll look at everything that Dr. Coben and all those people are trying to do, and we'll try to make it better every day. That's the job. That's absolutely what I try to do. And so, you know, you got to remember, you know, DHHR didn't get in this mess, nor did the roads get in this mess on my watch. This has been decades of the same kind of issues, all kinds of problems and everything. It's big stuff, and you got to fix it, and you know, and make it better. That's what we're trying to do.
All right, thank you, Mark. Next, we'll go to Curtis Johnson with WSAZ.
Hey, thank you so much, Governor. I got a question for you related to broadband. On March 30th, you vetoed House Bill 4001 related to broadband. In your veto message, you expressed support for the intent of the bill, but yet you also even promised that you would place it on an agenda for a future special session. But that never happened. Why did you not keep your promise, and what is your plan going forward?
Well, I haven't not kept my promise, and you know, we're still working on bills that are to sponsor and to resolve these issues, and you'll see them very, very, very soon and everything, but we just haven't gotten it done quite yet. But the intent absolutely was good, and you know, there's no need to put something up in a special session, and you know, until there's a consensus of how we can get it done. There's no point in just throwing something up there, and you know, until we can work and try to get these issues halfway resolved.
All right, thank you, Curtis. Next to Brad McElhenney with West Virginia Metro News.
Hi, Governor. Hi, everybody. Governor, I have kind of a companion question to the tax issue. Comments by Senate leaders seem to indicate they are preparing their own budget plan and their own tax proposal. Have you or your administration talked to them about what their plans are? And how much will communication and relationships affect the state's financial plan? If the two sides can't talk to each other, how can you come up with something everybody agrees to in the end? Thanks.
Brad, without any question, we're talking, you know, from the standpoint of me having direct conversations. You know, Brad, the Senate's plan is basically just this. The people spoke, and they spoke as clearly as they could possibly speak on Amendment 2. And they said, we're against it. 65 to 35. I mean, in a landslide election. And basically the Senate is just turning their nose up at the people and saying, we're going to still do Amendment 2. Now, I don't see how you do that. I really don't see how you do that. You know, we know exactly what their plan is, and literally, and we're continuing to talk back and forth to come up with a plan that will result in a good result. You know, I'm sure, without any question, that the intent, at least I hope and pray, that the intent is from the Senate side that what we end up trying to do is what is the greatest thing we can possibly do for the people of our state, for the economy of this state. And with all that, Brad, and I don't say this braggadociously, but I've got a lot of business experience, probably more business experience than anybody in this building, and with all of that, I am not stuck in the mud on any particular thing. All I'm wanting to do is guide and direct us to come up with the best path forward, the very, very best path forward. Another great mind in this is, ex-chairman Householder, now majority leader Householder. I think all the players should absolutely come to the table. It should be, President Blair, Chairman Tarr. It should be Majority Leader Householder. It should be our Speaker of the House, Roger Hanshaw, myself, and our new Chairman of Finance, Chairman Chris. All of us should be in a room together, and we should absolutely discuss this rationally and everything, and not be wedded to one way or another, and come up with the very best result we can possibly come up with for the people. And I am dead ready to do that. I have been ready to do that all along, like it or not like it, but just, I'm always hung up on the truth. The truth in the very beginning was there had been many overtures to the Senate, but prior to the election, in regard to some kind of level of negotiation, and we got zero, and everything. And now the election has been, and the people have spoken, and now we want to go back and say, well, it doesn't matter what the people said. We're going to do it ourselves and everything. Well, it doesn't work that way with me. At the end of the day, sure, you can override me and do this and that and everything else, but at the end of the day, I hope to goodness that really, really smart people and smart minds will come up with a good compromise and a really, really good thing for the state of West Virginia.
All right, thank you, Brad. Governor, I'll turn it back to you.
Well, let me bounce back to this and everything, and I think I got this exactly right from Dr. Marsh, but I may have missed it, but he said, I think he said an XTB, or it could have been ZB, but XTB 125 variant mutation that probably started in the United States. It's massively contagious. He also said that it contributes for 75% of the cases now in the Northeast, and you see that our hospitalizations have risen from not long ago at 114 to today 360. And they've corrected me to say that that's an XBB variant 125. You see that without any questions, that if you're over the age of 65, if you'll listen to our coronavirus czar, Dr. Marsh, who is a brilliant mind, and absolutely he will tell you that 80 to 90%, it gives you an 80 to 90% better chance of not being hospitalized, and a 2.5 times better chance of not facing something as terrible as death. So with all of that, if you'll just add it up, that's all you got to do. You got the flu, you got RSV, and you got COVID. And you got the flu, RSV, and 360 patients in the hospitals today with COVID. This thing could turn very, very, very quickly to where our hospitals are overrun. Little teeny babies with RSV could be a catastrophe. Without any question, it all points right at one thing. Get your vaccinations and get your booster shots, whatever you do, especially if you're 50, 60 years old. You have got to do that. That's all there is to it. It points directly right at that. One more time. In West Virginia, our hospitalizations have, in a very short period, risen from 114 to 360 today. without any question. Dr. Marsh just said, if you're over 65 years of age and you're fully boosted, fully vaccinated, you have an 80 to 90% better chance of not going to the hospital. And you have a 2.5 times better chance of not facing something as bad as death. Absolutely, without any question, come on, West Virginia. You've got to understand, the hospitals could very well be overrun with flu, RSV, and you've already got 360 in hospitals. That 500 is the magic number where all the health experts are saying we can't handle more than 500 COVID patients without going to emergency measures. We got our chance right now. You got to go get those booster shots. Like I said a minute ago, I love you with all my soul and everything. Let's keep pulling the rope together. Thank you so much.